I'm Luke Chow from the Morpheus Clinic for Hypnosis in Toronto, Canada, where we make hypnosis make sense. In this video, I'm going to explain why hypnosis is not as much like medicine or surgery as it is like education or instruction. I think the idea that hypnosis is like medicine comes partly from the idea that many early hypnotists were doctors or were affiliated with doctors, and that hypnosis has had a history of being used for, well, when the term was used, hysteria and neurosis, but also for conditions such as IBS, pain management, and other issues that are not purely physical or organic, but do have a mental or psychological component. So because of that history, hypnosis does have an association with medicine, but it's more like education or instruction than it is like surgery or taking a pill. And I do want to bust open this idea that being hypnotized is like being operated upon, or like being given a pill or an injection of some kind. Because that analogy, again, that false analogy, causes clients to sometimes feel like they should be passive, that they are not an active participant in their own change. And that attitude that they should be passive is detrimental to their own progress. Each person is the only person who can make their own consumption choices, their own decisions. I'll use smoking as an example. Cigarettes don't just end up in your mouth, lit. For a cigarette to end up lit inside your mouth, you'll have had to buy the cigarette or the pack of cigarettes. You'll have had to buy a lighter. You'll have had to go to a place where smoking is permitted. You will have had to reach into your pocket, pull out a cigarette, pull out the lighter, light the cigarette, and smoke it. The person taking those actions is the person responsible for taking those actions. When I work with smoking cessation, it's a matter of decision-making, making different decisions. When I work with overeating as well, or weight loss, it's also a matter of making different decisions. So we must acknowledge the client's ability to make decisions. We have to acknowledge that the client has free will. That's something that doesn't really happen in medicine or surgery. When you are literally unconscious on an operating table, you don't have any will at all. You just are at the mercy of the surgeon, and they're going to operate on you. And when you take medication, there is a placebo effect, but every medication has an effect beyond just the placebo effect, and that's not something that mentally you can just kind of will into being. The cases that I take on, the clients I work with, have issues that can be resolved by adopting or learning new attitudes, new perspectives, or a new worldview. If you see your practitioner, your hypnotist, as being like a trainer or a coach or an educator or an instructor in better thinking or more beneficial thinking, or ways of thinking that work for people who don't have the problem that you have, it's a much more fair way to approach hypnosis and understand how it works than the idea that it is like surgery or that it is like medicine. Because it means that the work done in the session room, being like a lesson, is introducing you to the new ideas. Outside of the session room, just like in between piano lessons or just like in between golf lessons, the way that you're thinking about what you're learning and the way you put it into practice very much determines how well you're going to internalize the lesson. And I am in the business of helping clients internalize thoughts, beliefs, perspectives, attitudes, mindsets that will benefit them in the situation that they're in. So if you are thinking of doing hypnosis, it's important to understand that the practitioner you work with is half of the equation. You, the student or the client are the other half. If you take even the very best instructor in the world and ask them to teach 100 students, then you test their knowledge at the end of the semester. You'll find grades ranging in most classes anywhere from A or A+ down to D or F. And these are students who have attended the same lectures. They are students who all have gathered for the same purpose, and yet the outcomes, the internalized knowledge and information varies widely. Partly it's how well the students pay attention. Partly it's also how they might internalize or reinforce the lessons outside of class. Partly there is an innate ability for some people just to learn more quickly. Other people just need more repetition before they can internalize a concept. And these are factors beyond the control of the instructor or the hypnotist. So we do our very best at our office to assess people coming in to find out their motivations, their history, their suggestibility, and so on, so we can try to ballpark guess if they're going to need more repetition or less repetition. But in any situation, there is no magic to hypnosis. The practitioner is part of the equation. You as the client, you're the other half. And the practitioner's role is to communicate, to allow you to open your mind first, and then communicate better ways of thinking about the situation that you're in. And your role as the client is to be listening carefully and internalizing the ideas in the session room, but also to recognize your essential role to your own success outside of the session room. If you feel like you must test, for example, if you can still think about public speaking in the old ways, and if it's still going to make you afraid, I can give you the answer up front. Yes, if you think about public speaking in the anxiety-provoking ways that you used to have, yes, you will make yourself anxious again. If you think about public speaking in the more true and reassuring, or true and inspiring, or true and confidence-inspiring ways that you'll be taught, then you will be calmer about it. If you are tempted to smoke a cigarette to see if you can, I will give you the answer up front. Yes, you can. You can smoke a cigarette just like I can smoke a cigarette, but I don't, and I don't want to. I'd rather not. When I work with smokers, I want to give them the option that they'd rather not, by showing them and teaching them and then instilling the mindset, the worldview, the perspective of a non-smoker. So I hope this video helps to clarify why hypnosis is more like instruction or education than it is like medicine or surgery. If you have any questions or comments, feel free to leave a comment below in the comments section. If you've enjoyed this video, if you find that this was informative, then please click like and subscribe for more content that's like this. Again, it's Luke Chow from the Morpheus Clinic for Hypnosis in Toronto, Canada, where we make hypnosis make sense.